Hello, good people. I'm Divana Aliya Dewi Widjaja. So it's such a great opportunity to be here and convey my speech today. I'm as a student. I will convey my speech today based on my research. So the issue that I would like to bring up today is about a topic that some people still ignore about it, even though uh, the thing is important to know by all people in this world. So, the topic that I will convey to all of you today is about eating disorders in this era. So, first of all, it will be a good thing and make you clearer if I give you first what is the meaning by eating disorders. So, based on the American Psychiatric Association, eating disorders are a behavior condition that characterized by severe and constant eating disorders and is associated with the thoughts and emotions that cause discomfort and distress. These conditions can be very serious and can affect physical, psychological, even social functions. The types of eating disorders are anorexia nervosa, bulimia nervosa, binge eating disorders, avoidant restrictive food intake disorders, other specified feeding and eating disorders, pica, and rumination disorder. So, okay, first, I will show you how many percent of eating disorders affect two people in the next slide. So, according to the American Journal of Clinical Nutrition in 2019, global eating disorders are increased from 3.4% to 7.8% between 2000 and 2018. Particularly, anorexia nervosa and bulimia nervosa are more common in women, but they cannot be denied if they can all occur at any age and any gender. According to the American Psychiatric Association, eating disorders are often occur in women between the ages of 12 and 35. So it shows us that eating disorders can happen in teenagers' life. So, eating disorders are often accompanied by other psychiatric disorders. Genes and hereditary factors may also increase the risk of suffering from eating disorders. But they can also affect people who have no history of this condition in their family. Eating disorders can affect the nutrition of the body, heart, gastrointestinal problems, and other potentially fatal conditions. Proper medical care will make those with eating disorder return to uh, healthy eating habits and restore their emotional and psychological health. Today, even though there are many types of eating disorders, I will focus only on the major types of eating disorders. There are three types. First is anorexia nervosa, second is uh, bulimia nervosa, and the third is binge eating disorders. So, first of all, what is anorexia nervosa? Based on the American Psychiatric Association, anorexia nervosa is a condition shown by self-starvation and weight loss that resulting in low body weight that is incompatible with height and age. So, because anorexia is a serious problem, so it makes anorexia the highest mortality range. And anorexia nervosa is usually prompted by the fear of increasing weight or becoming fat. For example, people who have anorexia nervosa will consume a few foods with a low calories, but they will do a heavy exercise. Some sufferers of anorexia nervosa regularly will eat uncontrollably and also expel their food by vomiting or consuming laxative drugs. Some of the symptoms of anorexia are dizziness or fainting from dehydration, brittle hair or nails, and then muscle weakness, heartburn, and reflux that happen in those who vomiting, severe constipation, and then bloating and fullness after meals, and then depression, irritability, anxiety, poor concentration and fatigue. So, it shows us that anorexia nervosa or eating disorders have a connection with mental disorder. The treatment for anorexia nervosa can be followed by helping affected people by stabilizing their eating habits and controlling their weight and restoring their weight. For teenagers who have anorexia nervosa, the most effective treatment is parents to oversee food for their children. And in the case of severe anorexia nervosa, when outpatient treatment is ineffective, a special program such as hospitality is required. And everyone, the second major type of eating disorder is bulimia nervosa. What is bulimia nervosa? Bulimia nervosa is consuming a large amount of food in a short time associated with a sense of loss of control over their eating. People who have bulimia nervosa can be slightly underweight, normal weight, overweight, or even obese. Family members or friends probably do not know that a person has a bulimia nervosa because they do not appear underweight and may go unnoticed by people around them. Here are some symptoms that someone may have bulimia nervosa. First, there will be frequent trips to the bathroom right after meals, and dental decay resulting from erosion of tooth, enamel by stomach acid, and then heartburn and using of laxative or diet pills, recurrent unexplained diarrhea, and feeling dizzy or fainting from excessive purging behaviors that resulting dehydration. Bulimia can cause esophageal tears, gastric rupture, and dangerous cardiac arrhythmias. Cognitive behavioral therapy for bulimia nervosa can help patients normalize their eating behavior. Antidepressants can also be helpful to treat bulimia. Lastly, everyone, the major types of eating disorder is binge eating disorder. What is binge eating disorders? Binge eating disorders is consuming large food for a brief period. Unlike people with bulimia nervosa, however, they do not vomit, they do not fasting, they do not do exercise, or have laxative misuse. Binge eating is chronic and can cause obesity, diabetes, and hypertension, and cardiovascular diseases. So, the symptoms of binge eating disorder are first, they will be eating more rapidly than normal and eating until uncomfortably full. And the third is eating large amounts of food even though they're not feeling hungry, but they will still eating. And the fourth is eating alone because of feeling embarrassed by how much one is eating. And the last is feeling disgusted with oneself, depressed or very guilty afterward being eating. So everyone, the treatment for binge eating disorder is same with a bulimia nervosa. They can do a cognitive behavioral psychotherapy and has several antidepressant drugs. So, good people, those are major types of eating disorders, and it shows us that eating disorders have a connection with mental disorders such as anxiety and other mental disorders. So let me tell you again. Eating disorder is dangerous and important to know by all people in this world. We can prevent eating disorders happen by ourselves first, and we can also look people around us. And I'm sure we can do this together to prevent eating disorders happen. Once again, thank you.